Hello everyone, I am Dr. Mohan Kannam. I am a pediatric ophthalmologist, cataract surgeon and neuro-ophthalmologist. So I mainly deal with the cataract surgeries and myopia control in children, squint examination and correction in children, and comprehensive eye examination of the children. So myopia, it's a kind of refractive error where the patient or the child have to use the glasses because of the axial elongation or the change in the curvature. This happens because of the changes inside the eye of the kid. When the eye keeps on elongating, the patient has to keep on using the minus power glasses. Or if the shape of the cornea, that means if the black part of the eye, what we call it is a cornea, if the kid keep on rubbing the eyes, the shape of the cornea will change and he will have a glasses, we call it as a astigmatism. Myopia is a kind of refractive error which happens because of the elongation of the eye or because of the change in the curvature of the cornea. So if you look at the causes, what we look at again, if you revise, one is like poor sunlight exposure, second is poor green diet, more importantly excess screen use, and some amount of genetic factors. If any family history is there, decrease the screen usage as much as possible, especially in the growing age of the kids. Second is like green leaf vegetables. If they are not having good green diet, I suggest usually at least 2 times in a week during their growing stage to have the enough supplementations for their nerves and the eyeball. And I suggest to have a good lighting conditions inside the room when they are reading or doing the homework, and at least half an hour to 40 minutes or maximum 1 hour a day out playing under the sunlight. If we can keep these 4 factors under control, then the chances of having myopia in the kid can be decreased. We go with the special glasses or we go with the drops, and we'll be closely monitoring the kids. At Center for Sight, we have started our myopia clinics. The whole goal is to combat myopia, which is a very concerning problem in children who are going to school because of the change in the behavior and the change in the work style or study style of the kids. They are being forced to use the digital screen, they are gluing to the digital screens, they are having more refined food, as well as they are not having the good sunlight exposure. I request all the parents to get their children's eye checkup done once in a year at least, because children don't complain. We only come to know when they start watching the TV very closely or when the teacher gets give the complaint to the parents.
Follow Center for Sight and post your queries to get answers from the experts.